getting back to exercise after pregnancy is different for everybody, but there's definitely some guidelines that we can help you with. For the first 6 weeks, it's really important that you rest up, get used to being a new mum, and don't do too much. You can do as much walking as you feel comfortable. You can start your pelvic floor exercises, and you can do some gentle stretches such as rolling your knees from side to side and hugging your knees. From about 6 weeks, you're safe to return to things like simple impact-based exercise, as well as Pilates, yoga, cycling, and swimming. And then the guidelines are that around 3 months, it's safe to return to impact-based exercise such as running, jumping, and HIIT exercise. When you return to exercise, it's important that you're not experiencing any pain or any urinary incontinence or any heaviness. And if you're not sure about any of these symptoms, you can always book in to see a pelvic health physiotherapist who can guide you with your return to exercise. Symptoms such as urinary incontinence or prolapse can develop over time. They can develop as you start to put more work through your body, or you can notice them straight away. It doesn't necessarily mean you're doing harm. It just means that you might need a bit more support and guidance with the return to exercise. A walk-run program is a great way to start with returning to running, and it's definitely what we'd recommend. So starting slowly and slowly building up, following something like the Couch to 5K. There's lots of resources out there, but if you do feel like you need more guidance, we're always here to help. You can lift weights after having a baby, but it's not something we would advise straight away. Obviously, you'll need to be lifting and moving your baby and day-to-day objects such as your pram or your cot, and that's okay. You just want to bend your knees and keep the object close to your body. But talking about weightlifting, we're looking further down the line from about 6 weeks. But remember that it's not one size fits all. Everybody's different, and some people may be able to return to this sooner than others. You don't have to see a women's health physio before you return to exercise, but it's something that I would definitely recommend you do. I think there is a lot that they can help you with and support you with and ensure that you're looking after your body in the right way and ensure maximum recovery to the levels that you were at before. If you're not sure about returning to exercise or you feel that you need more help or guidance, then do book an appointment with our specialist pelvic health physios who can help you more.